I'm Simon Ash, trained as a dentist. I've been a consultant orthodontist in East London most of my career, and very fortunately been working with chest physicians, ENT, the range of specialties that you would expect to find in secondary care. I got into this area having been dragged kicking and screaming by a consultant in chest medicine who'd found out about mandibular advancement appliances and was particularly, his special interest was sleep medicine, and he felt that there was a place for mandibular advancement appliances and what I'd been doing. I first started working on the Somnowell about 14 years ago, being fairly dissatisfied with the other appliances that were out there, predominantly made of plastic and thermoplastics, since I realised that the problems that both I had with some snoring and a little bit of tooth grinding and so on were not going to go away. And this is common in people as we get older. We don't stop snoring. If anything, the problem gets worse. And I realised that it's no good giving patients something that was not going to last. There are just too many patients out there. We've got to find a more robust long-term solution. So I then looked at other materials, and the obvious one that came to me was the use of chrome cobalt. The advantage of chrome cobalt is it's very strong in thin section. So it's a metal, and a very, very strong metal. So it means you can make it rather like mouth jewellery. It can be very, very thin, tailor-made to the individual patient's mouth without the bulk, but with the strength. And therefore patients like it. It's comfortable, so their jaw is held forward, cradled by the appliance, so that they can actually wear this very comfortably in bed at night without little intrusion into tongue space. And it really is like a wedding ring. It's really comfortable once you get used to them. Because it's so easy to wear, because it's so comfortable, patients wear them. And if they wear them, they seem to work.
The Somnowell project is one that really interests me because I found great results on my patients. And I see my role really as excluding any comorbidity. So I'm looking at more severe forms of snoring, I'm looking at very blocked noses with loss of smell, I'm looking at tumours of the throat, I'm looking at bad tonsillitis, I'm looking at other things that may be associated with snoring, and of course sleep apnea as well, which needs to be excluded in all cases. What I found in my patients, and I treat a large number of snoring patients every year, is that there's a pretty much 100% efficacy with Somnowell once the patient tolerates it and has any other treatments required. Once it's fitted, it seems to work pretty much all the time.